Hi, everybody. This is Darren Dunlop with the Fargo-Moorhead West Fargo Chamber. I'm honored today to be joined by Chris Gilson, who is the Executive Director of Eventide in Fargo. Chris, thank you very much for joining us today.
Happy to be here. Thanks, Darren.
You know, your industry and your facility has been a lot in the news. I would assume that you guys prefer to keep that keep on the down low, but this really does give us a great opportunity to talk about Eventide and senior care living as a whole. And I was just curious if you wouldn't mind just discussing a little bit about the policies and the processes that you and Eventide have put into place, you know, leading up to the first confirmed case in your facility, and then maybe following that as well.
Yeah, no problem. Thanks, Darren. Yeah, we usually, not always great to be in the news, but sometimes just got to put some perspective on things, so it's okay. So pretty much beginning of March, our world in long-term care has changed. We started a task force, kind of Eventide-wide, just to learn more about COVID, to plan for COVID. And then we actually put a COVID emergency operations plan into place. I think it was March 11th. And that was also the day where kind of things changed quite drastically. So kind of overnight, visitation, screening all visitors, screening all employees at the front desk, communal dining, all of those kind of big pieces that were vital to our operations have changed. Changed to try to protect our residents. So since the beginning of March, we've only allowed essential visitors into our facilities. We've actually stopped visitation with family members from that point, which was really a challenging thing, and I mean, not easy for anybody on any side. But it was kind of the recommendations from CDC, CMS, and State of North Dakota at that time. So from that point forward, we've been only allowing visitors of residents on hospice who are potentially impending, which has definitely been a challenge. We've also been screening all employees too. So any employee that has failed our screening for any reason since March 11th has not been allowed into our facility. And then we've also been doing resident assessments. So from that date, we've been assessing our residents 3 times a day, just to see if there's been any changes. And then if there are any changes, we will test those residents in order to see kind of where we're at and to rule out COVID-19.
Chris, you'd mentioned that your testing of your staff and they're not allowed to come back to work, or those sort of things. So how are you, could you speak a little bit about well, I guess it would be quarantining your staff if they test positive, and then also your residents. What kind of care are the residents getting when they test positive?
Definitely. Care doesn't change. They're going to get the same care whether they're positive or not positive. They're going to be dealing with certain employees. We have employees on our quarantine unit that just work on that unit, that just work with those folks. Those employees have gone through a little bit higher level of infection prevention training. They'll be wearing kind of the full PPE garb that's recommended for dealing with a virus like COVID-19. So that unit's just really prepped and planned and prepared to deal with any COVID cases that we may have. And it is recommended that you'd move all cases to one location to mitigate and contain the virus as much as possible. And we have done that. We've gotten really proficient at that. The nice thing that it's been kind of validating through this whole process, working with the Department of Health from North Dakota has been fantastic. Their guidance, their support, their willingness to work with us has been second to none. So I mean, that's been a big help for us. But we've also seen that on our quarantine unit, we have not transmitted the disease to other residents once they've been on that unit, or residents that have been moved in from the hospital that are quarantined for 14 days and then go back to their normal room. That with the proper use of PPE, it can be contained, and you can prevent that transmission as long as you have that testing results data to kind of work off of.
It's well, I'm interested in following up with that a little bit. Now, on your testing, are you finding both residents and staff that they're testing asymptomatic? And if
Yes,
so,
sir.
what are some of the challenges of testing these people who are asymptomatic?
Yeah, and I think that's kind of, you hit the nail on the head there. That's been our biggest threat, and that to this day is still our biggest threat. Because like I've said, we've put all these measures into place, but somebody can be completely asymptomatic, can be a carrier of the virus, and they can transmit the virus that way. I think a prime example is when we started, we were assessing residents, and any kind of symptoms, we would get them a COVID test. When we got our first positive in early April, we got the support from the North Dakota Department of Health, and we were able to test that unit, but then also the whole facility. And I would say without that testing, we wouldn't be where we're at today, because once we got those results back, we had multiple staff and multiple residents that were completely asymptomatic. And we've actually had multiple residents throughout that have been positive throughout their positive experience. And then also once they've recovered, they haven't had any symptoms throughout that stretch. So to me, that's the scariest part of the virus. And that's why the testing is so important, because when we know about our cases, we can quarantine, we can mitigate, and we can contain the spread. But because of the asymptomatic piece, regular testing has definitely been a necessity for us to control, contain, and to try to be as successful as possible with preventing any more cases than there has to be.
You know, you were talking about your facility has been mass testing, and I believe you said since about mid-April, thereabouts.
Yep.
I believe I just saw recently that your facility on the Moorhead side was the very first facility in Minnesota to be completely tested, all the staff and residents. So that's nearly a month following the North Dakota guidelines. So I guess a question I would have is, first of all, why was the delay on the Minnesota side? And what are the challenges of a facility like yours when you've got different rules and regulations on each side of the river?
Yeah, and that's a tough question. I'm very fortunate that we were able to work with the North Dakota Department of Health, and I think they've really stepped up to the plate. And as an organization that's on both sides of the river, we want to give our residents the same experience and the best experience possible. So I think that it was really helpful that not only the state of North Dakota, but some folks at our home office have been stepping up to the plate and making sure that we allow for facility-wide testing. And like you said, mainly due to those asymptomatic cases. It's great that you have processes in place to test people when they have symptoms, but I think the scariest cases out there are the asymptomatic ones, because those are the ones that are walking through our facility without us ever having a clue. And without testing, we wouldn't. So I'm really glad that they were able to get tested. Like I said, a little bit timelier would have been fantastic, because you could quarantine and progress through your process a little more efficiently. But only one way to go now is forward, and I hope that they continue to get those testing results, and then they can mitigate this and get this under control to the best of our abilities. Because I think the reality of this, and it's something that's a hard pill to swallow, and it definitely was for us, you can do everything right. You can follow all the procedures. You can't completely contain this. So there's going to be cases that are asymptomatic, but in order to, I guess, work with those or be most efficient in containing those is knowing about those cases. And without testing, you don't know. So I think testing's a huge step forward.
Chris, we all see on the news the joyous occasions when people actually beat this
Yes.
this darn thing. So can you share with us a little bit about how your facility handles your residents and that do beat this?
Oh, for sure. That means the world to us. So we've talked about this before, and like our whole leadership team and everybody wants to be a part of that. And of course we have to social distance and we can't all be there at the same time. But believe me, all of our residents, they hear from us, they see us, they know us. They're part of our family. So when this hits us, it hits all of us. And when somebody recovers through this, we're sure as heck gonna celebrate that, and we're gonna celebrate it however they want to be celebrated. So I think you've seen a couple of those videos, but I mean, a couple of them are pretty individualized. So I mean, there's not just a one size fits all type of celebration, but it really depends on the resident. So, and I think of the 6 that we've had recovered, or 5 that we've had recovered, they've all been a little different, but unique in their own way. So,
that makes us all very happy. It's good to have a reason to smile in these days and times. But Chris, I guess we'll wrap up here. But I know you had talked about the preparation that you guys began, in early March, because you knew at some point something was going to happen. Well, so Chris, where do you see yourself, your facility, and Eventide as a whole, and maybe all other care facilities, in 6 months? What are we learning now that we can put forward, and maybe even beyond the 6 months?
Definitely. I think that's a really great question. And that's a good point to bring up. I mean, I'm going to talk about my facility, obviously, because I'm really proud of my facility, but I think the industry too, and as a whole, has grown a lot over this last month. I mean, we've had a lot thrown at us, and we've had to implement a lot. And you find out the quality of your team through events like this. And I would say everybody on this team, no matter what position they're in at this campus, has stepped up to the plate. When we got our first case, I had people that were willing and able and wanting to work with those cases, whereas we were thinking, well, gosh, how are we going to get people to work with this? We have people step up, and we see the slogan Eventide Heroes. But I think they're heroes for anybody that works in long-term care right now, and that are here working with this. And we are the face for our residents. We are that care for our residents, and without families and without others being able to physically be here, just the way that this team goes about providing care through this has been awesome. It's been an awesome experience for me. And I know the experience itself isn't awesome, but events like this bring out the best in people and teams, and this team is second to none in my opinion. So I'm just happy to be a part of it. But moving forward, I think that we need to realize that this isn't going to be a quick fix. This isn't going to go away. We're probably going to have to get used to some new norms as a society, and definitely as an industry. But I think we need to continue to be innovative and continue to adapt. So I do not think that we can keep residents in isolation, because I think that the effect of that is going to be far worse than the effect of anything else. So as we move forward, we need to find out ways to be safe, but also find ways to be more innovative and have our residents connect, have our residents get out, have our residents be active, and thrive. Because I don't think we're thriving when we're isolating. So yes, we're going to have to quarantine, and yes, we're going to have to work with this. It's going to happen, but we need to figure out a way to be innovative and thrive too. So I think we've taken steps to get there, but there's definitely more work to be done, and we'll definitely be doing that.
I think that's a very key point, because I think a lot of the facilities like yours, the social aspect is almost as important as the physical aspect. It's the interaction with the other residents. It's the interaction of family, and I can't even imagine the heartache of your residents and their families who just haven't had the opportunity to see them in probably coming up on 2 months now. It's one thing to wave through a window, but boy, it's another thing to get those hugs. And I know that we all miss those at this point in time. So, well, Chris, on behalf of the Fargo-Moorhead West Fargo Chamber, our community and our region, we want to thank you, your team, and actually all of our healthcare workers, and especially those in the senior care facilities, who are the families for your residents right now. The role that you're playing is maybe thankless, but as we talked about, those people who are recovering, some of those smiles make it obviously make it all worthwhile. And we want to just thank you, salute you guys, and wish you the absolute best of luck to getting back to some sort of normalcy here sometime in the future. So Chris, thank you very much. Thanks for taking the time today. And you get back out there, and I know that your phone's been ringing, and
Oh yeah.
Door's been knocking and you got things to do. So the next time I talk to you, I hope you're so busy you don't have the opportunity to take my call.
For sure. I really appreciate it, Darren. Thank you for everything.
All right. Thanks a lot, Chris. We'll hopefully talk to you soon.
Yeah. Bye.